everyone, I'm Dr. Lila Abbate and I'm a physical therapist, and I'm going to be talking today about post-prostatectomy urinary incontinence in men. So it's a sensitive topic because a male patient just had cancer and they're getting their prostate removed in order to have life survival. And then on top of all that complication and scary situations that occurred, now all of a sudden we're dealing with the potential urinary leakage and having to wear a diaper and or a pad. So it becomes a very uncomfortable situation, and men aren't used to wearing anything, no pads, no diapers. Women are more used to wearing sanitary napkins or tampons, things of that nature. So for a man, this is very emotional. So the discussion today is a little bit anatomy, just to give you some cue in and to understand what is going on when you're having a post-prostatectomy surgery. It's very important that you potentially go for what's called prehab, where you go and you visit with a pelvic health therapist once you have a scheduled time to have a post-prostatectomy surgery, so you can actually learn how to do an appropriate pelvic floor strengthening program, what we call a Kegel, learning how to do contraction of those pelvic floor muscles to strengthen, so that when you come out of your surgery you can actually do Kegels once you've gotten or your catheter has been removed. Usually it's about 10 to 14 days. So I'm going to go through some anatomy, and the anatomy is just very basic. When you're looking at a male pelvis, you see that you can see the penile shaft, and then the bigger circle is going to be the bladder, which is here in yellow. And underneath it, that little tan little nut is the prostate. And that prostate then gets removed, and the prostate actually creates some continence. There is a depth to it, and it kind of hugs around the urethra itself and creates continence. So when that part is removed, then the sphincters have to work a little bit harder. If I would have a bicep surgery, or if I would have a knee surgery, you can assume I'm going to have normalized swelling. That's just part of the healing process. And when that occurs within the pelvis, you'll notice that sometimes the muscles become very weak. All of this weakness can then contribute to urinary incontinence in men. So here we're going to be doing a pelvic health physical therapy assessment of the pelvic floor muscles. And when we do that exam, we're checking for strength. How strong are the muscles? Do they have normalized tone? And then can they actually contract fully? So as physical therapists, we grade muscle strength in 0 through 5. And I'm not going to go through everything, but 0, you have no strength. 5, you have normalized strength. So men typically should have 5 out of 5. There's no reason to have changes in between. There's no hormones affecting the system. You're not having babies. So when we talk about strength, you really should be pretty strong. And so then if you're not, you can have urinary dribbling and incontinence. So this is a way to help strengthen your pelvic floor. We can do home biofeedback training with you. We teach you exercises here also as well to do core strengthening, regain some hip strength, and then to do specific pelvic floor muscle strengthening. There is help for patients who have had post-prostatectomy surgery and that you don't have to wear a diaper or a pad. Please see a pelvic health therapist. Thanks again for watching.